Brian, thanks for doing this. Really good to have you here. I know being surrounded by people and lights and cameras might feel like a lot for you, so I'm happy that you're doing this.
Oh, it's different. This is kind of a first for me, but no, I'm happy to be here and share. So.
Before we talk about where you're at now, let's rewind a bit. What was the Brian Campbell of, 2-3 years ago? What were you like? Describe, the kinds of things you loved to do, the kind of energy you were able to bring to them. What was that Brian Campbell all about?
Okay. I was honestly constantly a moving person. I don't think I ever sat down by choice, other than, of course, just working at a desk. But outside of that, I was always on the move every day. Like when I would go to work, I would walk home part way, and it was just like 2.5 kilometers, but that was how I got my little walk in every day. A lot of my hobbies were all outdoors. I grew up in the country, so I would, I have a bunch of friends who love to go fishing, so I always go with them.
So full of beans, full of energy. And then when long COVID was at its worst for you, contrast with what that Brian Campbell looked like.
Oh boy. I had a bunch of kind of like health issues that led up to kind of like almost like, I guess, like a physical collapse essentially in my body. At my worst, that was me in my bed at least 22 to 23 hours a day, curtains closed, couldn't look at light, couldn't deal with sound. I couldn't stand for more than 5 minutes. If I would have a shower, I couldn't be in there more than 3 minutes or I'd start to black out. It was really hard to eat. I was super nauseous all the time. Very dizzy all the time too, so coordination was very off all the time. It was actually difficult to talk. I couldn't actually make sentences properly. My vocabulary was very small. Like it was almost like I was a child, or maybe like a 5 to 8 year old. I couldn't use complex words. It was rough.
Well, then here you are under bright lights and using lots of words and stringing big sentences together. So describe how you feel now.
So every day is different. I wake up. Some days I feel like I have a little bit of energy to get a few things done in the morning before I kind of like my energy is gone again. Some days I wake up and I just really can't do anything. But yeah, I can speak a little better now. I can think a little better, not by any means all day. It's just touch and go, where I forget so much. It's kind of terrifying. But it's getting better. Like in at least there is assurance that I'll hopefully get better than what I am even now. So.
Tell me about Dr. Kieran Quinn and how he fits into all of this in terms of the support and the understanding where you're at and what you're going through. Tell me about your relationship with him and his work at the moment.
Prior to meeting him, it was specialist after specialist. I've done probably every test that the Ontario medical, hospitals can do. I've gone through extensive blood tests, scans of every kind, and with all the results coming back with no kind of conclusive signatures to say what the problems are. My wife actually found just a little blip on Dr. Quinn when we were just reading over online while she was reading online, just for looking for any kind of long COVID doctor. So I reached out to him just with an email. He responded saying, you might be interested in signing up for this RECLAIM study that we're setting up. From there, it was amazing to speak to him because I could start a sentence, he could essentially finish it for me. So he's been super helpful, just in the connections to recommending Cornerstone physiotherapy and stuff like that. They've been helping me a lot with my heart issues and stuff like that, and learning and understanding how to pace myself with energy, which has been immensely huge because I was constantly going through crash after crash. Before I would feel good, I would do something because I was doing something, I was exerting too much energy, then I was crashing. So it's been all very helpful for me just to get to the point of where I am now. I probably wouldn't got to this point if it wasn't for Dr. Quinn. So
how does all of that contribute to that positivity that you talked about trying to summon?
Yeah, for sure. Getting any getting someone to be aware of like the situations, having someone that can recommend options. Being online when you're essentially alone trying to tackle this is nearly impossible because everyone seems to have an antidote, but none of them do. I've spent, honestly, a lot of money on any kind of vitamins I could get, any kind of drugs I could get, and really had zero results on any of the stuff that I was trying. And so it was great to have somebody who had essentially a good data set on this information, and then be able to use it effectively, because each and every person that tends to have long COVID has a varied symptom kind of problematic kind of thing going on. So it was definitely helpful to have him in my corner just to get to where I am now. So.
Mm-hmm. And so when you think about the work that Dr. Quinn and his team have done for you, but also continue to do with their research at Sinai, how does that impact your sense of hope for the future with respect to long COVID?
Oh, I honestly, I think all the work that they're doing right now is amazing. Just taking the data from all the individuals that have come and they've been able to help out to the point that they have with all the tests that they do and stuff like that. I think this will start creating proper data to help others down the road. And I feel that it's been fantastic that I've been able to contribute what I've been able to with help of Dr. Quinn and the Reclaim program that they have. And hopefully going forward, more people won't have to get to the point that I've had to live and have gone through. So,
what would you say, Brian, to, so many people going through long COVID, grappling with that uncertainty, wondering how much longer this is going to last? I mean, what would you say to people by way of encouragement or how to think about this through a hopeful lens?
For anyone who has long COVID, it's a very mysterious journey. Try to reach out to find help is definitely a benefit. Try not to take this on alone. For myself, finding Dr. Quinn at Mount Sinai was life-changing. One thing that I could recommend too is try not to always believe everything you read online as well too, which is very tricky there's a lot of stuff out there, a lot of smoke and mirrors. So try to go to the experts and try to find people who are working on this data day to day to try to help support you is the best thing I could say. And that's really all I can recommend. So
that's some good encouragement for sure. I know how precious your energy is, and I appreciate you spending some of it with us today for this conversation. This is really helpful. Thank you.
Oh, no worries. I appreciate doing it. So thank you.